Hello, my name is Stephanie Wong, and this is my project for Physics 112, a physical approach to ear infections. So first, I'm going to talk about the story of my ear infection, and then I'll talk about the anatomy of the ear, and finally, the physics approach that I took to treating my infection. And specifically, I'll be talking about the concepts of rate of flow and continuity. So, first, what type of piercing did I get? I got a cartilage piercing. And so this is also known as a helix piercing, and it's right near the top of your ear. And so this type of piercing is really easily infected because there's no direct blood flow to it. And the healing process is anywhere from 4 to 6 months. But I've had friends who have had their piercings for even a year or more, and it's still a little sore. So it's a pretty intrusive piercing. And of course the piercing has to go through the ear skin, which is this red thing, then the subcutaneous fat, which is here, and then finally the ear cartilage, and then goes all the way through it. And so how exactly did my ear get infected? Well, first of all, this type of piercing is very susceptible to infections, as I said before, because there's no direct blood flow in this area. And so, in addition to no direct blood flow being there, I also wear glasses when I study. So, when my glasses were hanging off my ear, then it allowed for some touching, which can spread bacteria and sort of irritate my piercing. Additionally, because of COVID, I had to be wearing masks a lot. And when I take my mask on and off, it's like my hands touch my ear, or if I'm reusing my mask, it's touching that infected wound. And so that was not good for it. Additionally, if I maybe accidentally slept on it, that irritated my ear a lot. And also, if I was getting dressed or was washing my hair, then it would get stuck on the earring, and it was just not it was not a recipe for success at all. Additionally, the actual mechanics of this piercing, it didn't really work in my advantage. The backing of the stud, it was more like a plate. So if you think of like a hoop, if I had a hoop on my ear, it'd be like this, and there'd be able to have airflow, right? But with this type of piercing, there's this, and then there's also like a circular backing behind it. And that does not allow airflow to come in, and that makes a very warm and very moist environment because of sweat, because of blood, because of everything else. And because of that warm and moist environment, it's actually perfect for the breeding of bacteria. Additionally, I got 2 piercings on the same day, and that I think really shocked my ear. And it was just not ready for that. Not to mention, it was in the same place, so there was very, very limited airflow because not only was the backing like a plate, but they were too close together. So here's the progression of my ear infection. This was about 3 or 4 days after getting it. You can see it's already a lot more red, and that's because there's a lot more blood flow here, so it's making my ear really hot. And it's swelling on my ear, as you can see in this picture. So it ended up getting pretty bad where I had to take out the bottom one. And the reason why my ear looks so oily is because I put on essential oils on, which I think actually helped a lot. But so my ears got really, really swollen because they were filled with this infected fluid and with blood that was trying desperately to fight this infection. And then finally here, this is me at the hospital where I had to take out both of the piercings and take antibiotics. And so now let's talk about the actual anatomy of the ear and the infected fluid that I keep on talking about. So as I said before, this is a subcutaneous fat layer, and this is basically a passageway for blood vessels and blood veins of the ear. And these veins and vessels filled with blood, they're so important because they carry lots of nutrients, and they carry white blood cells, coagulation factors, a lot of other things that help to repair open wounds. And so when there's a lot of blood, if there's a lot of blood in that area, then it will heal much quicker rather than if there's not. So if you see, this is where normal people get their ear. This is like a normal ear piercing to get it here in the lobe. And there's a lot more subcutaneous fat here. So that means that there's a lot more blood veins and a lot more blood vessels there that can help it heal really quickly with not as much pain. But if you look here, there's a very thin amount of the subcutaneous fat, which means that there's less blood veins, which means that the healing process takes much longer and wounds take much, much longer to heal. And so the infected fluid that was in my ear, it was filled with probably pus, blood, bacteria, a ton of other things, and just not good things. And so my body was really trying to fight that. That's why I was getting so hot and so swollen. And so in order to fight it, as I said before, new blood with nutrients and white blood cells needs to be pumped all the way up to where my ears are. And so you can see, from the heart and, of course it's a circulatory system, so everything sort of gets moved around, but this new blood needs to be pumped up to my ear. And as you see, these sort of pipes here are much smaller than over here. So I get less blood flow to my ear. And you can see even more closely here, these are all blood vessels. And this is the external carotid artery. And that was sort of the main artery that was leading to my ear, which would be about, here in a drawing. And so what really would help me fight this infection is the movement of fluid, the movement of blood, the movement of infected fluid out of my ear, that type of thing. So now talking about fluid physics. So really the main thing that happened in this infection was, or the main way that I could get rid of the infection was actually the rate of flow. And so we talked about the rate of flow. Basically, it's about how fast a fluid is moving through a pipe. And in my case, I wanted to get this fluid out of my ear as soon as I could. I wanted to get this infected stuff out of my body as soon as I could. So I wanted to increase the rate. And here's the equation for the rate of flow. It's velocity times area. And so if I wanted to increase the rate, I either have to increase the velocity or increase the area or increase both. And so I did that by a lot of regular, a lot of home remedies. So with heat and salt soaks. So I would basically soak my ear inside this warm water, and the warm water, it would dilate my blood vessels, so it would make the vessels larger. So it would make the area larger so that the velocity, if this velocity was the same, the rate of the flow could be increased. And also, this is a little out of order, but I put salt in my warm water stuff too. And the reason why salt is so good with the open wounds is because it was a hypertonic solution and osmosis happened. So basically the salt would draw out any type of fluid from the cells that were near the wound, and it would take some of the infected fluid with it, which allows for my wound to be sterilized and for it to heal much quickly. Additionally, I massaged it and I used gravity in my advantage, and that was sort of the velocity factor of this. Massaging, I sort of, I would massage the fluid into my neck so then it could be cleaned out, or I would try to massage it out from the piercing hole, and that sort of like a go-gurt to try to get the fluid out. And also gravity helped me a lot, especially when I was trying to move it down my body, down my neck. And the muscles of my neck really helped that too. I was able to sort of swallow and get that fluid down lower so I could get it out of my ear. And then, so the second physics concept that happened was continuity. Continuity means, continuous. So basically it's moving fluids that stay at a continuous rate of flow. And so, here the rate of flow must stay the same, but the velocity in the area can be different. So here's the continuity equation, and you see velocity 1, area 1, velocity 2, area 2, but these are both equal to each other. So here's an example. I just put in some numbers. Say you're trying to figure out velocity 1 and you have a diameter of 3 centimeters, and your second velocity is 5 centimeters with a 9 centimeter squared area. And so you can solve for the velocity, and look, so this velocity here is 15, and then this velocity here is 5. But if you multiply 15 times 3, it equals 45. And if you multiply 5 times 9, it's also 45. So that's why even if the pipe is bigger with a larger area, or if the pipe is smaller with a smaller area, the velocity can increase or decrease to make the flow of the fluid the same in like an interconnected pipe that maybe was like this. And so this is actually really practical to the veins in my ear versus the like vessels in my neck. And so, they're all connected, but they're all different sizes. They all have different pipe areas. And really, I could feel the difference in velocity in my body. I could feel the fluid moving faster or moving slower when it was maybe in the smaller parts of my ear or in the larger parts of my neck. And so, these have a lot of practical uses, the rate of flow and the continuity, if you haven't already figured that out. So for the rate of flow, by raising the velocity, I massaged, I used the force of gravity, and I also placed my head at certain angles so that the velocity could be increased and my rate of flow could go up. And then to increase the area, I did the warm water soaks to dilate the vessels and to make the area larger. And then for continuity, maybe it was not quite as much of a practical use, but knowing just the whole concept of continuity really helped me understand why the velocity in my ear would change in certain pipes. And it sort of made me, it honestly made me excited to be able to use these physics concepts in a real situation where, these practical uses could help me and give me a lot more comfort. So, in conclusion, first I told you about the story of my infected ear. Then I went on to talk about the specific anatomy about the ear. And then I talked about the physics of the infected fluid that was in my ear, specifically the rate of flow and continuity in these types of blood vessel pipe things. So, thank you so much for listening to my presentation for this physics project, and I hope you have a great day.